All right, we're here this afternoon with Dr. Ray Matthews, Indianola native, Gentry High graduate, and he's leading researcher, leading global researcher in the field of vitamin D. And we're going to get started. I'm going to ask a quick question here and just ask you to elaborate, give you the floor. Um, kind of talk a little bit about how vitamin D connects with infectious diseases.
Okay, first of all, it's a hormone and it controls your immune response and your inflammatory response. Or it upregulates your immune system or makes your immune system stronger. When your immune system encounters a virus, a bacteria, or fungal infection, it upregulates the white blood cell count. So one thing that vitamin D does is upregulates the white blood cell count and help the body fight off any type of infections, regardless of what type it is. So if you have a low vitamin D level, your immune system can't respond as accurately as it should to infectious diseases. So the disease take over rapidly in your body versus the white blood cells taking over.
You've talked a little bit. I've seen some of your posts. You and I have talked, and you've said many times that this is going to be a dark winter. What do you mean by that?
Well, you have a confluence of the common cold, which is a rhinovirus, the influenza, which is an influenza virus. You have influenza A, influenza B, and influenza C. Then you have the coronavirus, which is a COVID, which is a coronavirus. So you have three different type of viruses. And we know that the coronavirus has mutated over 200 times already. Actually, in the country of Denmark, they're getting ready to destroy 17 million minks because it has gotten into the mink population. We know that this virus can be spread to dogs, cats, lions, tigers. So this virus is constantly mutating. It is mutated to become more contagious, or it can infect you easier and is with a higher viral load. So they just had a person out in California that actually had the influenza virus plus the coronavirus. So God knows what this thing is going to do once it starts mixing with everything else. Then with the days being shorter, which means that we can't make any vitamin D in the wintertime or the northern hemisphere, people's immune system, your vitamin D level is 30% lower this time of the year than it is in the summertime. So all those things together, all those factors coming together is going to cause a horrific winter.
We keep hearing about the vaccine research, and they came out a couple of days past the election last week saying that there was one that was 90% effective. How realistically, how far are we out on a vaccine, and kind of talk a little bit about vaccine versus your vitamin D regimen?
Okay, well, first of all, I believe in taking vaccines as a surgeon or a healthcare professional. We had to take vaccines, influenza vaccine every year. We had to get the hepatitis vaccine. So in order to work in the healthcare profession, we were required to take vaccines. However, the problem I have with the new vaccine is that it was developed in 6 months. And so normally it takes 3 to 10 years to develop a safe, effective vaccine. Then they use a different technique to develop this vaccine in messenger RNA versus the old technique. So there have been adverse side effects with the new vaccine that I've read about, but the complete data is not out yet. And so I'm waiting on the complete data before I make a decision on the new vaccine.
And okay, so in the meantime, so this is kind of what you've said from the beginning, way back in March. In the meantime,
Yes.
whether we get a vaccine before the end of the year or in 2 years, what is important about taking vitamin D, and do you recommend a high dose vitamin D regimen for most people?
Well, first of all, I recommend you going to your doctor if you can get your vitamin D level checked. It may be difficult for some people. So high dose vitamin D, what it does is get your vitamin D level up to the normal level. Normal vitamin D, according to the federal government, is 30 nanograms per milliliter. However, I advocate a higher level for your vitamin D, above 40 nanograms per milliliter, because you don't begin to stimulate the immune system until you get above 40 nanograms per milliliter. You get maximum bone density, maximum muscle contraction. So basically, I've used all those things and I work with athletes. And so that's what it is just you're optimizing your vitamin D level so they can do more work, more force of contraction. They don't get as tired. They can jump, run faster, jump higher and longer. So basically, you're getting the vitamin D level up and letting the body immune system do the work. White blood cells, coronavirus cannot develop immunity against white blood cells. So as long as you get that vitamin D level up and you have a normal working immune system, your immune system should work more effective. So you're just sharpening the immune system to do the work.
Now, over the last 6 to 8 months, we've gone through surges, and then we've kind of contracted a little bit on the virus, and now we're on a surge again. What are some things we've learned about the novel coronavirus that we may have not known back in March?
This is a very unusual virus. Anything that gets my attention in medicine is very unusual because I've seen almost everything you can see in the human body. However, this virus does not behave like a normal virus. Normally, viruses go away in the summertime. Coronavirus, we had a surge in April and May with the coronavirus, and it did not go away. And so this virus has been ongoing for about a year. Every year, the flu or influenza virus kills between 30 to 60,000 people per year from pneumonias. As of right now, we're over 240,000 deaths from the coronavirus. And like I said, it's going to get worse this winter because we're not making vitamin D and then due to other factors. And so this virus does not behave like the typical virus, and it is mutated where it is more contagious. Then actually they had a study out there saying healthcare workers, in spite of wearing PPEs, are still 3 times more likely to get the coronavirus than the general population. So this thing is actually a smart virus is what I would call it. It's figured out a way how to get around masks and gloves and all that. But I still think we need to use things as precautionary. We said it doesn't affect kids. Last month, 61,000 kids in October were infected with the coronavirus. And the reason I believe that we didn't see high kids levels at first with the coronavirus because we canceled school in most places around March. And but also other myth is it doesn't kill kids. It can. And so this is a deadly virus. And so all the things that we know about viruses, I would just throw them out the window.
How can you, how do you go about, and of course, that's way above my pay grade, but how do you develop a vaccine against something that's constantly mutating?
Brian, that is a very good question. That's probably the most important question. Actually, imagine, I used a porcupine analogy so people can understand it. I know it's complicated science, but imagine the coronavirus is an animal, the porcupine. So it has spikes on it, or quills. And so we call those spike proteins are just like quills. So if you want to capture a porcupine, you wouldn't grab the porcupine by the quills. You're going to get stuck in the hand 100 times and probably get infections or need antibiotics. So if you want to capture a porcupine, the best place, the way to capture porcupine is to flip him over on his belly or his underside where he doesn't have any protection. And then you won't get injured or hurt. So with the coronavirus, the spike protein is the strongest part of the virus. And so in medicine, or just in life, you always taught, even playing football, you don't attack your opponent at the strongest point. You find the weakness and then attack that. So the spike protein is the exact strongest part of this coronavirus. And it's basically has a lipid shell around it, which is very thin. And then it has RNA genetic material on the inside. So the weakest point of this coronavirus is that lipid layer. And that's where the vitamin D attacks. It produces an antimicrobial protein which drills a hole through that lipid layer. So it doesn't even fool with the spike protein. And then the spike protein is mutated. That's what causes it to be so infectious. So that's the strongest thing. And so if it's mutated, it can basically fight off a vaccine sooner or later or become immune to it. And then you have to take 2 shots with these new vaccines out here. Then they have to be stored at negative 103 degrees. So it's going to require a lot of refrigeration. And so I was reading that these refrigerators, each one of them costs approximately $10,000 to $15,000. And I don't think a lot of rural hospitals can afford that. And how many refrigerators would you need in order to store this virus? And then how long will it have a shelf life need to be stored at that lower temperature? Then to transport it from the factory, you need a lot of dry ice. Right now, we have a shortage of dry ice in the country. So dry ice works real well. But the problem with dry ice is if you touch it, you actually get freeze burns and stuff. And so that's going to be a logistical nightmare, just transporting it and distributing, storing it.
Turning our attention to sports, we've seen several SEC games canceled this week, including Alabama, LSU, Mississippi State. You work a lot with football players and football teams. You work with Coach Saban and Coach Malzahn down in Auburn and all over. talk a little bit about coronavirus and how it affects young athletes, whether in high school or in college, and just kind of the risks associated with athletics right now.
Okay, well, coronavirus, there's a thing called long haulers. These are people that have lingering diseases even after the coronavirus is gone. They were mostly asymptomatic or had mild symptoms, but did not need to be hospitalized. So with this, long haulers, these people have headaches 6 months later. Some of them have fatigue, insomnia, and they say they're having brain fog and they're just not quite right. They did a study on some college football players where they did a cardiac MRI, echocardiogram, which are tests on the heart. They found out that up to 60 to 70% of these patients had inflammation around their heart. That can have long-term implications in terms of causing sudden cardiac death, congestive heart failure in the future, irregular heartbeats, and just other cardiac issues. So some of these long-term sequelae, we don't know how long because we're only like 8 months into the coronavirus. So I would suspect in 10, 15 years, some of these people will have major complications. And it also causes scarring in the lungs in 40% of people. So you probably see a lot of people on oxygen. You know, some people, even after they get out of the hospital, they're still on oxygen. And so it can cause neurological effects too and psychological effects. Some people have inflammation of the brain and they have delirium and seizures and just headaches. So I think it's a systemic disease, and it also affects the blood system where it can cause clotting. People get blue toes, and some people have had to have amputations. So this is a systemic disease. It's just not a pulmonary disease as we thought.
And as we move on into winter, we start to see some schools starting to think about their winter sports.
Yes.
Apologize for the dog. The basketball, cheerleading, soccer, stuff like that. You know, you talk about a dark winter, even darker than the fall we just experienced. You know, talk
yes.
about what are some of these schools? What are some of the questions they're asking right now regarding this virus and the spread?
Well, most people want to know how safe it is. Anytime you still have sports ongoing, well, I'm an avid sports fan. I love sports myself, but you know, in the present environment, we still have some unknowns about the coronavirus, how easily it can be spread. Things that we do know, however, is that it's airborne, it's highly contagious, it's in the ventilation system, it's in the sewage system. It travels further than the 6 feet we initially thought. It can travel up to 16 feet indoors. So everything we learn, we're having to relearn. There can be long-term symptoms or sequelae. You can be totally asymptomatic and still spread it. Then we found out that actually doing temperature checks and asking about symptoms can be misleading also, because most people, up to 80% of them, are asymptomatic and they can still spread it. They have no symptoms, but they can still spread it. So this disease still have a lot of unknowns that we don't know about it, and we're steadily learning each and every day. So not that scientists and doctors are trying to mislead people. This is a novel, new, unknown virus, really. So we're still learning a lot about it.
Dr. Matthews, thank you for taking the time out to be with us today. I know my dog had a few questions for you, but we just don't have any time. But thank you so much. And as always, we appreciate your insights and look forward to seeing you next time you're back in Indianola.
Okay, thanks for having me, Ryan.
Yes, sir. Thank you. Bye.
Have a great day.